Hello and welcome to NAHRO's Managing During COVID-19 webinar series. And today we're very happy to present information on homelessness resources and how those resources are working at the housing authority level. Before we get too far along, I do want to just give you a little bit of a technical information. I am your moderator. I am Georgie Banna, NAHRO Director of Policy and Program Development. And I do want to welcome everyone to today's session. Thanks for joining us, and thanks for our speakers for sharing the information with all of us today and the very important information. If you are having any technical difficulty, please contact us at professionaldevelopment@nahro.org. Again, professionaldevelopment@nahro.org, or feel free to give us a call at 202-289-3500. Again, 202-289-3500. We will help you with any technical issues that may pop up during the session. Also, just as a best practice in the general course of action, if a lot of the issues tend to wrap around audio issues, if you are having audio issues or any other issues, one of the things that probably solves about 90% of them is to log out of GoToWebinar and then re-click in and reconnect to the webinar, and that fixes about 90% of the issues. Just as a quick tip. We are going to, during the presentations, you have the ability to submit questions through the chat questions feature. Please go ahead and do that throughout the session, and then from time to time we will review those questions with our panelists today. There's also a handout in the handout feature. Again, in the GoToWebinar toolbar, you'll see handouts. There's a handout there. It is a homelessness activity framework and potential that one of our speakers will discuss further today. That is available there. We are recording today's session. It will be posted by tomorrow on the NAHRO coronavirus website. Again, www.nahro.org/coronavirus. We'll post it there with the slides for today's session. It's also a great resource, the NAHRO coronavirus page, for up-to-date information, both from HUD and other federal agencies as well. So please keep a lookout, take a look at that site. It is available to members and non-members alike. But with that, it's about time we get things rolling. And let me turn things over to NAHRO CEO, Adrienne Todd.
Great, thank you so much, Georgie, and welcome everyone to today's webinar at NAHRO. We're really excited that you could join us today, and we really hope that everybody's having a safe and healthy time, not just this week, but every week as our country goes through different parts of reopening and as you all adjust to the current normal. We have a very exciting platform to talk about today, homelessness, but more importantly, tools in the toolkit that we can use to help our homeless neighbors, no matter where you are. We are joined by two esteemed guests who are going to enrich our listening session today on all of the wisdom that they're bringing to us from not just being a thought leader, as we will have with my good friend and housing partner in crime, Nan Roman, but also a practitioner on the ground, somebody who is working on homelessness issues in real time in one of the toughest cities in which to be doing so, in the city of Los Angeles, and that will be Margarita Lares, who you will be hearing from. I have to say that both my time here at NAHRO and certainly when I led a housing authority, working on issues around homelessness is one that creates some of the most fulfilling times of, I know, my career, when you are able to help someone who is down and out achieve a home of their own, a space for them to lay their head. Sometimes there's no greater feeling as housers. And so we're very pleased to be able to provide both of these wonderful experts to you today to learn more about the tools that are available, including the new ESG money in the more recent CARES Act, but also how they're being applied at a local level. And so I'm happy to have Nan Roman Nan, as I mentioned, is a friend not just to me, but to NAHRO and to houses everywhere. She is the president and CEO of the National Alliance to End Homelessness, a public education, advocacy, and capacity building organization. And she has been a national leading voice on homelessness issues probably as long as I can remember, and certainly longer than she want me to admit on air right now. But she brings so much solution making to this issue and is just really a go-to voice for all of us on best practices everywhere. And we'll look forward to having her talk to us. We also have Margarita Lares, who might be a new voice for many of you. Margarita is the Chief Program Officer at the Housing Authority of the City of LA. And with that, she has responsibilities in the voucher program, in public housing, and with the LA happens to be a PBCA, a project-based contract administrator, administering the project-based rental assistance program in her part of California. Ms. Lares is a known expert in her field and has testified in Congress in the past on this issue. And we look forward to hearing about what she and the Housing Authority of the City of LA are doing on this very critical issue. And so with that, Nan, I'm happy to have you kick things off.
Great. Thank you so much, Adrienne. And thank you very much for having me. And let me say thank you to all of the people that are listening in. At the National Alliance to End Homelessness, we really do feel that housing is the solution to the problem. People who have homes may have lots of their difficulties, but they're not homeless. And so we appreciate the work all of you are doing, that Adrienne and her team are doing in Washington, and support your efforts. You are also, of course, very important leaders in your community in terms of what's going on around coronavirus and the pandemic. And so I really appreciate Adrienne giving me the opportunity to give you this sort of high level picture of what we're advising communities to think about when they're thinking about using these new resources that are coming in to address homelessness. As you know, jurisdictions are going to be receiving a significant amount of money to address homelessness via the CARES Act. In particular, there is $4 billion for the Emergency Solutions Program. That is versus about $270 million that were in the last appropriation. So nearly 15 times as much as a jurisdiction would normally get in a year. And there is other money in the Community Development Block Grant and coronavirus relief funding, not to mention FEMA funds and many other resources. And if we all do our jobs well, maybe there'll be some additional resources coming forth in the next stimulus bill, whenever that starts to move. So it's really critical that we use these resources wisely and strategically, even though they have to be used relatively quickly. It's not a business as usual situation. It's really not just a matter of spending the money as fast as possible. Homelessness really could grow or shrink depending on communities' approach to using these resources. We need to use the money, we think, primarily to address, well, it was designed for this, primarily to address the public health and economic recovery issues at hand. These are the immediate problems. We also need to use it in a way that will prevent a rise in homelessness and restructure homelessness approaches so that we're better off at the end of this and moving forward, when we're going to have a lot of challenges as well, I think. And we need to be careful to use it in ways that improve equity and equality. So there is a lot to think about, and a lot of money, a big infusion of money all at one time, and a lot of considerations about how to use it wisely. To help you think about how to use these resources, the National Alliance to End Homelessness, along with the National Healthcare for the Homeless Council, the Center on Budget and Policy Priorities, and the National Low-Income Housing Coalition, have put together a framework for the COVID-19 homelessness response. And this is a general guide of things that communities could be thinking about in terms of how you allocate your resources, the approaches you take, and in what order you consider taking them. Before I get to the framework per se, there were some very important overlying values that are baked into the framework, as it were. Could I have the next slide? First, there is a commitment to address racial and income. Actually, we need to go back one slide, I guess. A commitment to address racial and income disparities. It's really important to note, which I'm sure you're all very aware of, that both homelessness and the pandemic shine a light on racial and economic inequality in our nation. Both disproportionately affect African Americans and some other racial minorities, at the moment specifically Hispanic and Latinx people, and very low income people. We need to use the funds in ways that eliminate disparities and don't exacerbate disparities. And this is a critical overlay to the framework. Key ways the framework suggests doing this are involving people with lived experience, people of color, and extremely low income people in planning and implementation, collecting data on what you're doing and making sure that you have the ability to look at your performance on the basis of race and income equity, analyzing data for disparities in services and outcomes, and remediating any disparities that are found in that data. Another, and in the homelessness sector, of course, the data primarily that we collect is through the Homeless Management Information Systems, HMIS. Another important value of the framework is the imperative to help people with the highest needs first. People who are unsheltered, older, medically vulnerable, disabled, ill, and literally homeless should be helped before people with less serious barriers and problems. Those are the people also that are most likely to be affected by the coronavirus and by the economic situations we'll be facing. Only when all of those high need people are helped should resources be turned to those slightly better well off and to prevention. And here I'm speaking about with the homelessness resources. There are other resources that could be used to help people with less serious problems. The point is not just to spend the money quickly, but to spend it wisely, and helping the most vulnerable people first will achieve that. It's also been pointed out to me that while it can be tempting to first sort of pull off those people who just need a little bit of help or to try to prevent people from becoming homeless, taking that approach can compound discrimination, because it tends to divert assistance from people who have already suffered from racial discrimination and marginalization in areas like healthcare, criminal justice involvement, foster care, and housing, and therefore have more complex problems. So helping the most vulnerable, highest need people first is both more effective. We've found this repeatedly in the homelessness system in terms of reducing the overall number of homeless people, and also better helps us address racial and income inequality. Another important priority is to get, and this is where you all come in, is to get people into housing as quickly as possible, people who have been homeless. Getting people off the streets and into appropriate shelter at the moment is, of course, very extremely important, but it is not the only goal. We need to take an opportunity of the stimulus resources to get people into housing. That is going to be the best protection for their health, and it is going to be the best way to ensure a solid economic recovery, and those are our goals. We certainly do not want to move people to hotels and motels, which I'm sure you're seeing in many of your communities, only to send them back to the street or to congregate shelters. We really must use this opportunity and these resources to get people into housing quickly. Succeeding in using these resources well is likely to mean that meaningful partnerships have been created between the homelessness sector and, most particularly, I think, the housing sector, like housing authorities, and healthcare and employment partners. Public housing authorities and public health and health departments are particularly critical partners for the COCs. Also, continuums of care. Also essential in many communities are police and fire departments or other emergency services departments. Many aspects of the homelessness work will be better carried out and are financed by partner entities. Prevention is particularly important to think about in this context, because Most of so-called homelessness prevention is not really preventing homelessness, it's really preventing eviction. It's actually eviction prevention. Relatively few poor and low-income households with an eviction notice actually become homeless, at least in the short run. So prevention that focuses just on eviction does not have the needed short-term impact on reducing homelessness. That is not to say that eviction prevention is not important. Eviction prevention is hugely important. But as long as there are people that are already literally homeless, almost half of them living unsheltered and on the street, eviction prevention should not largely be funded from the homelessness funding, because we just can't write off all the people who are already homeless, especially in the context of the pandemic and community spread. And finally, we must act quickly in the context of the pandemic. Business as, and I'm sure that you all are seeing this as well, business as usual will not work. We must remove any barrier that can be removed and act with alacrity to move people indoors, to attend to their health, to protect them, and to get them into homes with jobs and healthcare and prevent a new wave of homelessness after the pandemic. And this has to happen in weeks, not in years. Next slide, please. So the purpose of the framework is to provide some guidance on where to focus the community's efforts and in what order as communities are thinking through these new resources. And the framework lays out 5 key things that policymakers at the local level and leaders such as yourself should think about. They are people who are unsheltered, shelters, housing, diversion and prevention, and improving our approach. All 5 things need to be addressed, and if they can all be done full bore, that's great, but most places will likely be setting priorities, and that should be addressing the public health and recovery crises and helping the highest need people first in terms of priorities. The framework indicates the order in which things can be addressed. I'm not really going to discuss that here. I'm just going to quickly run through the activity areas. Could I have the next slide, please? And these, I'm not going to discuss these particular bullets just for you to look at. These are some of the examples of strategies that are in the framework. I'm just going to give the big picture. The first key area of focus is on people who are unsheltered. Living outside or in places not meant for human habitation is certainly not acceptable in the context of the pandemic. Not acceptable anytime, but really not acceptable now. Unsheltered people cannot take preventive measures such as hand washing. They cannot reliably maintain hygiene. They typically live in unhealthy environments, and their baseline health is much, much worse than that of sheltered people, not to mention people who live in housing. They are extremely vulnerable to the disease. The lack of testing among homeless people has prevented us from having any certainty about the risk of infection among different groups of homeless people, although some indications are among unsheltered people that the rate of infection is twice what it is in the general population. I don't think that's reliable, but it's interesting. Many unsheltered, certainly we need to move unsheltered people into private rooms or health facilities if that is what is needed. And that is the CDC guidance. Many unsheltered people will likely refuse to come in. In their experience, they've had to give up a lot to get space in a shelter, and they often don't get a lot in return for what they've given up. This is often because shelters are high barrier, they have a lot of rules, and they do not provide any significant pathway to housing. So it's really not an irrational decision for them in normal times. But we'll need to find alternatives like low barrier housing focused shelters that are acceptable to them so that we can get people in. Next slide, please. The second key area of focus is shelter. Congregate shelter is not a good place for people in general, again, even in the best of times. It is stressful, it is often traumatic and unsafe, and it is clearly not a good public health strategy. An immediate priority is to reconfigure shelter space according to the CDC guidelines for social distancing, quarantine, isolation, and medical care. All shelters should be low barriers, should accept pets, possessions, and partners, and be housing focused. A longer-term priority, I think, is to eliminate congregate shelter altogether in favor of shelter with private rooms and bathrooms, and to shorten the length of stay in shelter by moving people more quickly into housing. I think this pandemic is pointing out that having over 500,000 people a night in congregate style shelters and on the street is not good for any of us. Next slide, please. The third key area of focus is housing. The framework recommends that jurisdictions stay the course on whatever they are currently doing around housing, that they check with existing rapid rehousing tenants to see if they need additional months of rental subsidy, and that they check with permanent supportive housing tenants to make sure that they are receiving adequate services. I'm certain this is true in your jurisdictions and your work as well, but in the homelessness sector, we're seeing a lot of staffing issues because so many staff people have had to drop out either because they became ill or family members became ill. They have kids at home from school and so forth. Moving forward, communities can be planning to move all people who are in private rooms to housing, including permanent supportive housing, so those would be the most vulnerable people, and eventually to move all people experiencing homelessness to housing. This will certainly require getting much more creative about housing models, including shared housing, repurposed, purchased housing, shallow subsidies, returns to family, and most importantly, we'll obviously need to get a lot more resources to pay for that housing, and we're working on that in partnership with NAHRO and many others. Next slide, please. The fourth key area is diversion and prevention. Diversion is for people who have become homeless but have not yet entered shelter or moved into the street. And diversion can really reduce the number of people that become homeless significantly. It's much better to catch people before they enter the shelter system. You can get them rehoused much faster. It makes sense to go to scale on this quickly. The homeless system is doing that in many places. It often requires flexible funding, hard to come by typically, but some of the new money is more flexible. Prevention, as I mentioned, generally should not be funded using homelessness resources because we really don't know how to target homelessness prevention very well. So it's unlikely that it will prevent very much homelessness. It generally ends up being more eviction prevention than homelessness prevention. If communities help everyone who is homeless and end up having resources to do prevention, they should start by targeting the very lowest income people at the highest risk of homelessness. So people who are disabled, transgender, and so forth. Next slide, please. And finally, we believe that we could come out of all of this in a better situation by improving our systems for the future. We could establish strong partnerships between COCs, public housing authorities, public health departments, and employment systems. We could establish equity-based decision-making. We could realize we can stand up shelter a lot faster than we thought, eliminate congregate shelter, realize we can house people a lot faster than we thought, and end up stopping a new tranche of people becoming homeless as the pandemic ends because they don't have jobs or homes. And we could create a more just society by ensuring that everyone, no matter their race, ethnicity, gender identity, age, disability, or LGBTQ status, receives equal treatment because we paid attention and we did things more and differently to help people to avoid and escape homelessness. Next slide, please. So that's our framework. We're going to be updating it every few weeks as things change. You can find it on the Alliance website, which is endhomelessness.org. We're talking to various groups like NAHRO to share it with them and their members. And we're going to be adding a sort of appendix that will have all the tools and protocols and plans that cities and TA providers and others have been creating to save people time in ramping it up. Next slide, please. And I won't go through it, but these are some of the funding sources that would be available. Mostly got additional funds through the CARES Act to assist in paying for all of that. So thank you very much, Adrian. And
thank you. Yeah, thank you so much, Nan. Not only did you lay out the a framework, you also created a framing of the issue in terms of how we were before the pandemic and concerns we may have as we begin to exit and reopen, and the impact it will have on people who are homeless now and unfortunately may become homeless because of the different housing instability issues some families are experiencing. So and now we're going to pivot over to Margarita, who's going to talk about the wonderful work that's happening out at HACLA, the Housing Authority of the City of LA. Margarita, the mic is yours.
Okay, great. Good day, everybody. I hope you all are doing well and carry on as we normally do. I suspect that many on this webinar are housers like myself. I do bring about 22 years of experience doing this work. I've been with the Housing Authority of the City of LA, also known as HACLA, for about 18 months now. But prior to that, I was with the County of Los Angeles Housing Authority as a director of Section 8. I was there for 20 years and as a director 13 years. So I have a lot of experience in housing in Los Angeles and certainly a lot of experience in the last 10 years in dealing with the major crisis that we've been faced with, which is people experiencing homelessness as well. I did prepare a PowerPoint, which you all are viewing here, and I did want to share with you that there's a lot of background information as to the size of our organization, our initiatives, and the work that we do at HACLA. It's there as background information for you. I don't want to spend a lot of time on the background information. I'm sensitive to the time and interest of everybody on this webinar and to talk about the real issues. But I did want to tell you that we operate a fairly large Section 8 program with close to 50,000 Section 8 vouchers. We have a fairly large asset management portfolio that the agency has had in building its own housing, as you can see on the slide. We have about 6,900 public housing units throughout the city. And then we have several other programs that are geared towards housing our homeless families and individuals, such as the continuing care program and so forth. And of course, as Adrienne mentioned at the beginning, I also have oversight of a PBCA program with close to 50,000 units in various territories with huge concentration in the city of Los Angeles. Next slide. Initiatives. So HACLA has actually been focusing on providing permanent supportive housing for many years, at least 10 years. And so the next 5 or 6 slides talk about the fact that we have actually been actively trying to resolve the homelessness crisis in Los Angeles by placing a large number of our portfolio, almost 20,000 units, towards this mission of reducing and hopefully someday eliminating homelessness in Los Angeles. Next slide. And here are some examples of some of the initiatives. We have a waitlist preference for homeless individuals, where we currently are utilizing up to 4,000 vouchers to assist. Next slide. We have a tenant-based supportive housing a program that we've had in place with a partnership with our Department of Mental Health and Health Services as well, where we work together. They identify the clients, and most of these are mutual clients in which we are able to house very rapidly. Next. Permanent supportive housing using our project-based vouchers. So HACLA has always taken advantage of project basing for many years as well, but in the last 5 years, we've committed additional vouchers towards the homelessness effort. And HOTMA has allowed us to increase the number, and we continue to do that today. Next slide, Georgie. HUD VASH, and many of you may have the VASH program. We have a very successful VASH program here in Los Angeles with an allocation of 4,600 VASH vouchers, and we're always being awarded new vouchers every year. Obviously, Los Angeles has a great demand for vouchers as well. Next. And we also have a preference and have this preference for veterans as well that are homeless. So we're very proud of this program because we've had this particular one for many years. Next slide. And of course, you all may be familiar with the Continued Care Program. We have about 57 grants here in our housing authority that we work through our local homeless services agency, which is LASA, and we partner with 22 different agencies. Next. And we have an established mod rehab single room occupancy that's mostly used in our downtown LA area, also known by many as Skid Row, that has been well established and highly utilized on an ongoing basis. Next slide. And this final slide gives you a summary of all the different initiatives that we have, totaling 20,283 rental assistance. Next. We have a moving program that we established through, again, our Los Angeles Homeless Services Agency, where after someone has been established that they are able to live independently and not require much case management and supportive care, we move them onto our very regular voucher program, and therefore that certificate or that previous voucher can be given to another individual or family. Next. And we continue to commit through a program called Home for Good. This is a local initiative, again, with our local homeless services as well as with the United Way, that we work together to continue a process of streamlining how we assist our homeless individuals and how we prioritize individuals and connect them to the most appropriate housing and supportive services. Next. The Homeless Incentive Program was actually created 3 years ago, and it pays incentives to owners that are willing to house a family or an individual who is experiencing homelessness. The components of this are providing a sign-on bonus to the landlord, paying for credit checks, security deposits, and a damage mitigation claim. This is paid with all local dollars, specifically with a 0.5% tax that is sales tax that the residents of LA County voted for in 2016. Next. Crisis management. So this is really the crux of my presentation, to talk about how we are managing the current situation. Next slide. But what I want to say is we were already in a crisis mode in Los Angeles. As you all know, and it's been published very well in the media, is that our problem with homelessness continues to escalate. And I'll share with you, for example, our 2019 point-in-time count actually grew compared to the prior year. The County of Los Angeles itself counted 58,936 individuals, of which 36,300 were in the city of Los Angeles alone. That represents a 12% increase from 2018. Of course, we did conduct a point-in-time count in January of 2020, although at this time we do not have the results. What came out of that point in time is that 63% of in the state of California, people experiencing homelessness are first-time homeless individuals. Of those, 53% stated that it was due to economic reasons. That's important to note because, as you know, there's a lot of stigma, a lot of incorrect information as to why individuals become homeless. There are many reasons, but what we are seeing here in Los Angeles, the greatest reason is economic reasons. More recent reports, since COVID-19, we now have in the County of Los Angeles a 20% unemployment rate, which is undifferent than the rest of the country, of course. The poverty rate in California is the highest in the United States. LA County residents, 24%, meet the poverty rate as well. So pre-COVID, we were already in this crisis and trying to figure out what these numbers mean. And even though the city of LA and the county of LA has put a lot of resources to help with the homeless crisis, we were still plagued with many, many issues to deal with. Next slide. So right around December, right after Thanksgiving 2019, our Los Angeles Homeless Services Agency actually reached out to HUD for assistance. And we were actually provided with a technical advisor that came out and met with us early December of 2019 to sort of grasp what has been going on, understand the numbers, understand what resources, what's working and not working. And as a result from that, a new work team was created called Housing Central Command, and that was launched in December of 2019. Headed up, of course, by our homeless service agencies, but also in partnership with the HUD technical advisor, who really came in and used the approach that's used for disaster response, such as disaster response when people lose their housing as a result of an earthquake, or more recently, hurricanes, of course. So using that approach, we created the Housing Central Command. All the executive directors of the agencies in the area are participating in that. That includes HACLA. Also, the County Housing Authority is also a co-lead, as well as our departments of mental health, health services, public health, and about 22 other agencies are also involved. What did we focus on? We focused on having a goal to increase our utilization of permanent supportive housing, and that we were going to focus on doing this in calendar 2020. Making sure that we identified everybody that really is out in the streets and have been matched through our coordinated entry system, and what housing resources were available, and really truncate the timeline from moving people from living in the streets to actually being in permanent supportive housing, which was our ultimate goal. We went ahead and moved through streamlining a lot of our processes and really coming up with a vacancy to move in work plan that we believed at that time to be extremely good. Keep in mind, this was all pre-COVID-19. We started the process with re-engaging our clients and condensing timelines to make this happen. And when we were in the midst of all of this, we got hit with the pandemic, right? And what do we do now? Now, everything that we had put in place prior to that became extremely important, but also taking into consideration that we needed to do even more than what we were doing at that time, which was we looked at implementing additional flexibilities. The reality is that the housing authorities really did close down to the public on or about March 16th. But that didn't mean that we stopped serving our clients. We just had to take a different approach, like many of you on this webinar, is to start to do our work in a very different way, meaning that we can do much of the work via the telephone, via email communications, and we also agreed as an organization that our desire to follow our normal best practices of meeting directly with the client really was not ideal at this time. That we had to trust our service providers that had the regular and continuing contact with our homeless individuals and families, and that we needed to trust that they were going to be that communication piece. They were the link to continue to be successful in housing people, not just temporarily, but definitely with permanent housing. So that this allowed us to actually create some go-to videos that we put on YouTube to facilitate communication with our service providers, who also were teleworking, like many of the housing authority staff were doing as well, creating general emails where we can do email blast communications to the greater community as to what we're doing, and giving them the authority to complete paperwork on behalf of their clients, and then submitting it to the housing authority so that we can continue with determining eligibility for the various programs, as well as contracting and actually moving in clients into housing. So I'm very happy to report that in the period between mid-March and where we are today, we were able to house an additional 270 families or individuals that were experiencing homelessness. We also continued our normal work, believing that it's very important to continue to develop permanent supportive housing with our project-based vouchers. And on March 19th, in the midst of everything, issued a NOVA to the development community. We closed the NOVA last week and have already selected projects for continued housing. We have been a big supporter of Project Room Key, again, understanding that it is temporary housing, but with an exit strategy. And where the Housing Authority comes in is with the exit strategy of moving these folks from motels, hotels, and any other temporary housing into permanent supportive housing, utilizing the resources that both the city and the county have. In addition to that, we are developing an acquisition plan because it's also important that we need to grow our housing stock. Currently in Los Angeles, we have a vacancy rate that's below 4%. I'm not sure what it is in the last couple of weeks, but the last time I checked, that's where we were. Landlords are having a difficult time with opening up their units for, tours and possible applicants just because of the crisis. But we have been able to encourage many to continue to rent their units and keep them active in the rent rolls. And at the same time, the Housing Authority of the City of Los Angeles is looking to have a acquisition program, and we are exploring working with the state of California and purchasing some housing that we could convert to permanent supportive housing. We are also working with the city of LA in developing an emergency rental assistance program. This is to aid individuals that are having difficulty paying their share of the rent and therefore keeping them housed and preventing homelessness as well. Next slide. And that is my formal presentation. I'm going to thank you. This happens to be a photograph. I'm in the picture. I'm one of the persons in the picture. But this is our entire management team at HACLA, along with our executive director and CEO and president, Doug Guthrie, and our board of commissioners. So I will pass it over to Adrian for the Q&A.
Great. Thank you very much, Margarita. That was a lot of rich information, and it's good seeing my friend Doug Guthrie on that picture there. Doug, I don't know if you're listening, but keep up the good work, and thank you for your leadership these days. So it's that time for questions. And Georgie, I'm going to ask you to remind our audience on how they can ask us a question.
Absolutely. Thank you, everyone. To ask a question, please go to the chat feature or the question feature in your GoToWebinar toolbar. You can type a question in right there, and then that question will pop up into our question queue, and we'll address those questions as they come in. There's still room in the queue, so if you have questions for Nan Roman or Margarita Lares, please submit those questions now. And Adrian, let me turn things back over to you.
Great, and as we're waiting for some additional questions, I see some there, and we'll get to those in a second. Let me ask both of you, sort of a recent phenomena given the onset of the pandemic was a very rushed attempt to move many of the homeless into hotels and motels. Just from a public health perspective, so folks were social distancing and not sleeping on the streets. I'd love to hear, Margarita, your views on what happened in LA, if that happened in LA, in and around the California area, and Nan, just your thoughts about that as a strategy, and what do we see on the other end of that action, given where we are right now with the pandemic? I'd love to hear from both of you on that.
Sure, I'll go ahead and start. So definitely Project Room Key is taking place all over the state of California, and especially in the city of Los Angeles and county of Los Angeles. Very successful in the city of LA. Again, not ideal situation, but under the circumstances, the only humane thing that we could possibly do is to bring people into motels. Very well received within the city limits. The program has had some difficulties in other areas of the greater Los Angeles, of course, due to NIMBYism, which we all experience across the country. What we're doing in Los Angeles specifically is coming up with an exit strategy as to what happens next. Now that we have them under a roof, we need to connect them to the permanent supportive housing, and that's where the City Housing Authority, meaning HACLA, is starting to work very closely with LASA and providing that exit strategy.
Great. And Nan, any thoughts?
Yeah, I think it's you know, it's just such a strange occurrence that we should be having this situation in which there's also, where so many people are at risk, but there's also all of this vacant space that in hotels, motels, B&Bs, you know, and congregate space too, convention centers, arenas, and so forth, that's available. And it's a bit of a win-win since people aren't really staying in hotels and motels. So I think it's a great idea. I think California was ahead of the game too, because they had been anticipating this before the virus really to get people off the streets. So they got a little bit ahead of the game there. I think it's been very effective, but you're obviously raising the important point, which is what happens next. A lot of places, I mean, FEMA will pay for the hotels and motels. Not every jurisdiction has negotiated that. California has negotiated that. So that's another plus, because then the emergency solutions grant money and can be used for temporary rental assistance. We'll need longer term assistance, and we'll have to get that. But I think that it's kind of set up in a doable way, assuming you can find the units, which, as I mentioned, is a challenge. And I think we're going to have to be a lot more creative about in terms of sharing, returning people to family, and so forth. But I think it's a good thing. There have been a lot of challenges also in staffing it, just because the homeless programs are, as I said, short-staffed, and they're kind of doubling their space through decompressing and opening up these motel and hotel deals. But it's a good strategy, protects people, and I think sets us up to get them into housing.
Right, and I think you're right, Nan. I heard you mention that we are gonna at some point, and probably some point soon, need to begin to focus on a longer term strategy of folks, whether that's a long-term rental assistance or some shorter term assistance. And I know that NAHRO is working with its members on its advocacy there. You know, I know that some of us are listening to Margarita and saying, "Wow, those are really big numbers," and it's staggering even for me. And just a reminder that we know that homelessness looks different in different parts of the country, whether you're in rural America or suburban America. Sometimes homelessness is sleeping in your car. Sometimes it's couch surfing. So we know it's not all of it is Skid Row, and there's certainly lots of all of the things that Nan talked about is and should be available in your communities as well. Different scale, but certainly the importance of those partnerships and in scaling a program that works for your community is so key. And NAHRO will be presenting a future webcast like this one that's focusing in on the experience in rural and suburban America. Here's a question for you, Margarita. Did HACLA accept signatures from service providers on behalf of individuals and families?
Yes.
Interesting.
Yes,
You want to? Are you able to elaborate? Yeah.
Yes, we actually prepared a very simple affidavit, and that's what we provided, and we accepted it, and we did ask HUD technical advisor, and they accepted it as well.
Great. There you go. That's something that many of you probably had not thought about doing, and that's certainly a best practice there. And maybe a question for both of you. Both of you have been in this space for a while. One of the things that we hear our members talk about a lot is, what do we do about ID and alternative identification? Sometimes our homeless neighbors may, not have a driver's license, certainly may not have their a long form of their birth certificate. What advice can we give from both of you? What advice can we give NAHRO members about things like alternative IDs?
Well, I can start. Margarita probably knows a lot more about this from the perspective of the Housing Authority. I mean, the programs, if people are working with programs, that's sort of task number one, to help people get ID. I don't know what's going on with that at the moment. I know here in the district, it's not really possible to just get an ID from the DMV because the offices are not closed, but they're basically not operational for getting a driver's license at the moment. So, but generally speaking, homeless programs, getting ID, ways to get ID is on top of one of the first things that they do for people.
Well, I can address very specifically to the continued care program. We actually got a response from HUD very specific to that question. And again, this is specific to continued care, and I don't want anybody to confuse it with the Housing Choice Voucher program. But the response from HUD is the continued care program interim rule does not require recipients or subrecipients to collect birth certificates, social security cards, or picture IDs in order to document eligibility for a COC program funded project. So, right. Again, not required for the continued care program, is required for the Housing Choice Voucher, but we also indicated that in the affidavit that we would get from the service provider, if they had any verification that they received themselves and could certify that they have received it, that we would accept that as well.
That's great. Thank you for that. I know that's something that's raised so often amongst our members, and questions that I've received as well. Let's see. Here's another question, actually from the same individual. Where is the continuum of care interim rule located? I suspect it's probably on HUD's website.
Yes, you could find it there, and I think that.
And we will definitely put it.
We will get that information.
Yeah, and we can also put it on the NAHRO website as well. And after this webcast, we can certainly put it there for anybody who's looking. Here is a question from another attendee. As there has been problems getting tested across the nation, are we finding it difficult for there to be testing amongst folks who are homeless? I'm not quite sure what the experience is like from a city perspective, Margarita, or whether or not that's been a conversation among the homeless advocates, Nan.
I'm looking up some data on this. So Margarita, if you have anything to say while I'm trying to.
I don't have any. Go ahead and research data. I don't have any data, but I can share some anecdotal information. We are having, as much as they've increased testing in Los Angeles, we don't have the numbers of people that need to be tested. And since I have oversight of public housing for HACLA, I happen to know that our residents are not being tested. The test sites are not generally in convenient locations for people that have to utilize public transportation. And so that is a barrier in itself, is the location of where the testing is taking place. Not necessarily convenient for the poor and not convenient for those that don't have means of good transportation to begin with. And in addition to that, you can't just show up for testing. You have to schedule an appointment either by telephone or through a computer. So that also can be a barrier for individuals. We at HACLA are exploring bringing in a third party that will actually do testing on site for our public housing residents. And certainly once they are on site for our public housing residents, they can also test the community around there. So I can just share with you anecdotally what I believe that is a challenge is to test not just the homeless individuals, but also the poorest of the poor in our community.
We just did a survey of now I've lost it again. No, we just did a survey of COCs. It's not the strongest survey, scientific and so forth, but I'll just tell you what it said about screening. It said that 84% of COCs reported that they are screening all sheltered persons, but when a shelter resident tests positive, only 14% of COCs have sufficient capacity to test all the residents in the shelter. So and half of COCs reported that they had no testing ability at all. So they aren't testing, although we expect there are places where they're testing, and we expect to see a lot more testing. I know that Los Angeles did do conducted 9,000 tests of unsheltered people, and they found the rate of COVID infection among that to be 2%, which is, and again, this is not a scientific, survey, but that's twice the rate of the general population. So that's among unsheltered people.
Thank you both for that. And thank you for looking that information up very quickly, Nan. Very nimble of you.
These things are on at the moment, right?
I know, I get it. Yeah. I get it. So we're getting close to 3 o'clock Eastern Standard Time. So I'm going to begin to close things down here. Thank you both for the amazing bits of information that you shared. And I know that folks have other questions out there. Sorry if I didn't get to it. Georgie's going to give you some information about where you can send your questions, and we'll be sure to get it to Nan or Margarita. And thank you both for the amazing work that you're doing. Any final thoughts for the attendees before we switch over to Georgie?
Just to thank everybody again and say how important your leadership is in the community and the focus on housing and the need to get all these folks into housing. So thank you for that. And thank you, Adrian, and your colleagues at NAHRO for your partnership. It means a lot to us.
Thank you. Likewise for Margarita and HACLAs, thank you very much for this opportunity. I will be happy to respond to any additional questions, and I will wait to hear. Everybody, please stay safe and positive, and we can get through this as well.
All right. Those are great final words. Thank you. And Georgie, back to you.
Thank you, Adrian. Thank you, Nan. Thank you, Margarita. Great information. I think definitely the programs have to work together. The partnerships between the programs and the program participants and our agencies is definitely key to all of this. So thank you for all that information. Here is my contact information, and as Director of Policy and Program Development, and Tess Embry, our Director of Congressional Relations, both working very hard on the HUD side and the congressional side, along with our entire NAHRO team. Please reach out to us at the NAHROblog.org. There is additional information, hot topics as things come up. They are posted there. Also, NAHRO.org/advocacy for our advocacy pushes and education pieces to help inform Congress of the needs of our housing authorities across the country and making sure they hear our collective voice in Washington. Again, there is the handout. The framework is available in the handout section. It will only be available. We'll post it on our website, but it is available during this session. You can click it right on the handout there and click on the link. The webinar itself and the slides and the handout will all be posted on the NAHRO website at our NAHRO.org/coronavirus site. Again, NAHRO.org/coronavirus. All that information will be available there. It's open to members and non-members alike, so please feel free to share that information. But with that, have a great afternoon, and thank you for all your time and attention. Have a great day. Bye-bye.